Stop. Before you go for that cervix check, watch this video. Because if you're planning a natural birth as natural as possible, then you need to know that cervix checks can actually lead to you getting a C-section, getting an induction, or otherwise having your birth more painful and traumatic. Hi, my name is Carly Bonderud, and this is the Empowered Birth Series, where I go deep into everything that you need to know to plan and get your empowered, true natural birth. So today we are going into trap number 3 on our list of the 20 natural birth traps. If you want the full list, all you have to do is go to empoweringmomsbirth.com/freebies, or you can watch the video within the 20 traps playlist on the YouTube channel. Basically, what you need to understand about natural birth traps is that these are the things that undermine your confidence or outright sabotage your attempts to get a natural birth. This is what happens, basically, is you want to have a natural birth, so you think you're doing everything right. You are getting the birth books, you're getting the education, you're starting off on your path of finding the videos, the podcasts, and you're like, I'm going to have a natural birth. But what often happens that a lot of moms don't recognize is that as they're consuming this education, there are things that are kind of sabotaging them along the way. These are the natural birth traps, and we have basically normalized them in our birth culture as part of what it takes to have a healthy baby. And one of these things is the vaginal exams at the end of your pregnancy. If you are a mom who has already recognized that you can say no to these, then you might already be thinking, I'm not having any vaginal exams, so I already know what you're going to tell me. And I understand that. As somebody who did know that I could say no to these vaginal exams, I had hired a midwife with my first pregnancy. I knew that these were optional. At the end, I still ended up falling into that trap. And the reason for that is because you get to a certain point in your pregnancy and you start to get curious. We can't ignore that we are in a very dilation-centric culture where dilation seems to mean something. It means that something's happening on the outside. But the truth is that the physiological process is a lot more complex than that. But even a birth worker, somebody who understands that the cervix is not a crystal ball, can get tricked. So it is my job as the empowered mom to ensure that you get to have all of the information that you need to plan and get your empowered true natural birth and stay out of the natural birth traps. But before we get started, I'm just going to point out this shirt. You see this shirt? You like this shirt? My dear friend Jenny, who runs Empress Birthworks, actually created this because I said to her, you know what, I would love to have a t-shirt that I get to wear on some of my videos or when I'm out talking to moms that really gets that empowered birth message out there. And Jenny, being a designer, decided to design these t-shirts. So if you want to know more about how to get this one or other designs that Jenny has created, you can go to empressbirthworks.com and check out her merch section. Or what you can do is, have you checked the description of this video? Are you on YouTube? If you are, then check the description because I include transcripts as part of the Empowered Birth overall system to ensure that you can get that education, because you may be really good at getting the overview when it comes to videos, but you might also be a visual learner, or you might be somebody who likes to take a deeper dive and get more information. Maybe it's that you don't have time to watch the whole video and you'd prefer to skim, or maybe you've watched a few times and now it's like, you know what, I'd like to go back and just get the overview of what happened. Or what was that link that she told me about again? What was that resource? Well, I'm embedding resources inside of the transcripts themselves. So again, go to the description on the video, make sure that you click that and save the actual link, because I go back and I add more to these. So this is an ever-transforming resource. In fact, everything within the Empowered Mom community is ever transforming. The idea is that you can take the surface level with the headlines and the overview of what you want to learn. Then you can also take a little bit of a deeper dive and get more of that education. And then, of course, the deeper you go with empowering moms, the more treasures that you can uncover for yourself. Because honestly, I could keep talking about birth all day, but I don't know what's going to work for you. And I want you to take what resonates and leave the rest, because you are your own best expert at empowering moms. And I believe that you deserve to have information be free, and you only need to pay for what you actually are going to use. And information is free. I only charge for access to me and to my team at a lesser level. So I have 3 paths for getting the empowered birth method. And the first is the do-it-yourself path, which these deep dive masterclasses basically are. It is like getting your feet wet into the education side. You can check out my other social media, including my Instagram, where I do little soapbox rants. That is my stream of consciousness without any of the polish. So I do make mistakes. I sometimes go off on a tangent. There's a lot of things within that. It is freestyle. Then I also have my reels that are usually bite-sized pieces of my content. Again, these are on Instagram. I also put these out on Threads. I put these out all over social media. I scatter my magic to the wind, and I put out these insights. The deeper you go into my community, I also have a community newsletter. And this is basically the end of the do-it-yourself path, where you subscribe to the newsletter, you pick and choose all of the information. And if you have any questions, you just reach out, you hit reply to any of the emails, and then either myself or one of my team members will get back to you within 1 to 2 business days. If you are not subscribed to the newsletter, you are not technically in the deeper circle of the empowered birth community, but you are still important. So even if you're not subscribed to the newsletter yet, and you're not sure if that's the path that's right for you, then I'm just going to let you know that as a member of this empowered birth community, by just stumbling upon this video, if you find value in it, please like, share, and subscribe. Pay it forward, pass this on. Because the thing about these deep dive masterclasses is that it's not fluff. I'm not just giving you a nice feel-good story and then telling you to buy my course. In fact, what you're going to want to do is set some time aside to watch these videos properly. This is not something that you just sit and watch casually and get entertained. If you're looking for that, you're probably going to find more value by just going to my Instagram and checking out some of the reels, or just skimming some of the content, or checking out some of my shorter videos that I do. But the deep dive master classes it's really an actual free class that you're attending right now. So I want you to treat this as if you were paying for it. I am committed to you having an empowered birth, whether you work with me or not, whether you get any of my products or join my self-study. But the thing is that if you're going to do that, you're going to want to take advantage of the rule of 3. The rule of 3 is simple. First of all, you're going to want to watch this video all the way to the end as step 1. Then, once you've done that, you're going to have the overview of what was in the video. And you're going to be like, cool, now I know what to do. The second part is to watch it again. When you watch it again, you're going to get aha moments that you didn't think that you had before, because you were still just getting your feet wet in the education. Once you have those aha moments, you watch it a third time and integrate it. And suddenly it's like, I've got this information. Now I am far less likely to fall into the natural birth traps. So take advantage of the rule of 3, and energetically, if you want to give back to the empowered birth movement, then this is where you want to like, share, subscribe, pay it forward, engage with the content. Make sure that you're commenting in the videos. Make sure that you go on to the social media, and otherwise get this out there. Because I could either put all of the money that I get from my clients and from my products and services into paid ads to get this information out there, or I could put it to actual use to getting you your empowered birth and helping moms that are in maternity care deserts so that they aren't stuck with hospitals that don't respect their birth choices. Because you know what? You can say no to vaginal exams, and there are also still some medical professionals that will force them on to you. And we want to make sure that you have access to medical professionals that are going to actually respect you. And there's a whole big thing with that where our birth culture is still in a place of fear. So in order to shift that, we need to shift to the empowered birth method. And the empowered birth method is that we aim for a true natural birth and respect our physiological process. And then we only pull back as much as we need. Because you know what? We are in an age where the medical system has now gotten to the point where they can mitigate risks. But we don't need to stay there. We have also gotten to the point where we can trust our natural process and we know we can call in that medical intervention. We are not going to be going back to the dark ages by choosing a home birth. We're not going back to the dark ages by choosing an unassisted birth, whether that's without anybody attending you at home or you're choosing to do an unassisted in the hospital and use the hospital as backup. Aim for true natural birth, pull back only as much as you need. So the thing about vaginal exams is that this is basically ingrained where it's like, how dilated are you? Basically telling you that you're either having signs of labor or you're progressing in your labor. Now, the reason that this is a trap, I'm actually going to first share a story. Then I'm going to tell you how this undermines your confidence, sabotages you, and pushes you into interventions. Then I'm also going to tell you how the medical system views the vaginal exams and how this is a trap, and how to also get out of it. I'm going to give you the empowered birth method. I'm going to show you how you can apply the empowered birth method to either deciding to have a vaginal exam or to not have a vaginal exam. And of course, if you want more resources, I also tell you other things that you can use for your education. Make sure you get the transcript from this video because I am also going to put the resources in that transcript. Now, the last thing I'm going to also tell you is about the 3 paths to getting the empowered birth method. I'll go deeper into that. I'll tell you more about how to make the most out of your empowered birth journey. And then I close off by telling you what's coming up next in the empowered birth series. But if you really want to know what's next, then you can go and get the list of the 20 natural birth traps. You just go to the description in the video or go to empoweringmomsbirth.com/freebies if you want the overview of the entire empowered birth method and you want to know the mistakes that you could be making as a first-time mom, a seasoned mom, or even a VBAC mom, or you want to know more about true natural birth versus natural birth in the medical system, I'm also going to encourage you to check out the START guide. So you go to empoweringmomsbirth.com/START guide, and that will give you the overview of everything. And again, the deeper you go with empowering moms, the more you're going to uncover. And I want to make sure that this is accessible for you at whatever level that you are at. So what you can do with this video is you can skip ahead and find the recap or just read the transcript. As I said, I've put the transcript in there. You'll kind of know where you're at. I don't keep the timestamps in there deliberately because that can be very distracting. But you can kind of get an idea of what you want to look at, and then you can go back from there. Also, YouTube does its own transcripts. So if you ask for the transcript, it will show up now on YouTube, and you can see through there in the timestamp where you want to go next. But the reason I'm doing this is because some moms, they only have 5 minutes and you just want to get the headline. Okay, if that's the case, then within the transcript itself, you're going to want to look at the blue text. And you're going to also want to be following along and seeing where I put the headlines in the video. So they are going to pop up on the screen for you. If, however, you like to have more information, then you're going to want to look at the bold text in the transcript, or pay attention when I'm talking about the highlights of the empowered birth method or anything else that I'm basically teaching. So once you understand that part, If you want to take a deeper dive, this is where I also pull resources. I tell you about books that you might want to check out. I tell you about other articles that I've read. I tell you about other influencers that I've followed, and I tell you about my own experiences. I also tell you about the resources that you can get through empoweringmomsbirth.com, and a lot of them are embedded inside the transcript itself. And finally, I also give you the invitation to go anywhere with this. You can get the free path, again, do it yourself, piece everything together, go find the other videos, find the treasures, put together your own map. All I ask is that you pay it forward, like, share, subscribe, pass this on, get this out there to other moms who need it, because again, I don't want to put a lot of money into advertising. I would much prefer to have the majority of the proceeds that go into empowering moms to go back to the community itself. And again, you can check my start guide to learn about my philosophy and mission statement. I'm also going to let you know that when you have an empowered birth, you're an empowered mom for life. No one can take your power from you again. The empowered birth method is not just about birth. It is also about your transformation into motherhood. It is about having the most extraordinary life possible. And I'll tell you about that later into this video. So let's get started, because first I'm going to go into the story. Okay, so you know that cervix checks technically they don't mean anything. And if you don't know that, then I'm just going to tell you that your cervix is not a crystal ball and it doesn't mean anything if you have a cervix check. All it's telling you is that this is what your cervix is doing in the moment. And your cervix can change immediately after that. And it can also change back. And this is where I want to tell the story. So, as a second-time mom, I now understood that not only did I not want cervix checks because they were painful and uncomfortable and sucked, but also I didn't want them because they weren't necessary at all and would not predict when I was actually going to go into labor or when I was going to have my baby. I also understood by reading Ina May's book, Ina May's Guide to Childbirth, that this is also counterproductive. There's something called sphincter law, where the sphincter muscle does not want something going up. So the sphincter needs to be able to relax, and the cervix is a sphincter. So these cervix checks actually cause a lot of problems because now your cervix doesn't want to be checked. If it wanted to be checked, it would be on the outside of your body. It is not. But because of our cervix-centric birth culture, and the way that the medical system basically started by pathologizing women's bodies and treating us like defective machines, you need to understand that this is usually the measurement of which progress is determined. If you want to check out Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage, if you read about rights of protection, particularly in the labor chapters, then you'll understand why this is a problem. But in my case, I was a birth worker. I was a birth advocate. I was working through improving birth as a rally coordinator. I was having my second baby. I planned a home birth, and I knew cervix checks meant nothing. And I knew I didn't want them. But weeks of prodromal labor was starting to erode my confidence. It was frustrating me. And I started to ask the question, what is my cervix doing? This was the wrong question to ask. Because again, this ties into how my labor went. So I go into labor at 40 weeks. And at this point, I had been doing stop and start labor and nothing was happening. And I didn't believe that I was in early labor until the next day. So now we're at 40-1, and I've called the doula to the house. Still no cervix checks being done. But as the day progresses, and nothing seems to be happening, I still seem to be in and out early labor, I recognize that I need to go to this appointment with my midwife, and I don't want to be in the car for this appointment. So I had to call the midwife office, and I had to say, hey, I think I'm in early labor, so how about after clinic hours are done, you can come to the house? So this was my thoughts. And then she's like, well, okay, do you want me to assess you? And I'm like, you know what? I really do at this point. And this is where I opened the door for something that I really, in hindsight, didn't know was coming, but now I do. So I'm just going to say backstory. This midwife was also newly certified. She'd only been in there for about 3 years. Unlike my previous midwife that I had, who was 2 years away from retirement and therefore no longer cared if she broke the rules. This midwife needed to play by the book. And one thing you need to understand about home birth is that in our community, in my medical system that I have in Canada, if you're having a home birth with a registered midwife, because midwifery is actually registered under the medical system in my country, then what happens is that the midwife has to call the hospital and say that a home birth is in progress. Now, this still put me on the clock. Even though I wasn't at the hospital, my progress was still being charted. So by agreeing to this first vaginal exam, the cervix check, what this did was this now established me at 4 centimeters dilated. And I'm like, okay, now I'm technically in active labor, except I'm not. And as the night progresses, and I'm still not going any deeper into my labor progress, the midwife is then asking to check me again at 4 hours. And I said no. I said no, and she let it drop. But then another 4 hours went by, and she's like, I really think that we should check you. And this time I agreed. And as I was laying there and she's doing the cervix check, it was so horrifically painful that it was probably the worst part of my labor. And it is a lot of why I factored into my decision to birth the way I did with my daughter the next night. Because after that check, my cervix closed right back up again. I was no longer 6 centimeters. I was now 3 centimeters. And this is written down in my chart. And labor completely stopped. Nothing was happening for several hours. For 2 hours, nothing seemed to be happening. It just stopped. And the midwife is like, okay, so labor has completely stopped. It's shut down. And you've been in and out of labor for a while. And no progress seems to be happening. Now, I know you don't want to do this, but the thing is that if you keep going in and out of labor, this could stress out your baby. And, sometimes we just have to intervene for the safety. And I know you don't want that. So here's what we can do. I can close up this file and I can go home. And we'll call this another false start. But if you go back into labor and you call me, then I'm going to have to reassess you. And if you're not far enough in progress, we're going to have to consult an OB. And they're probably going to want to transfer you to the hospital. They're probably going to want to break your water and get things going because this can't keep going on like this. For a second-time mom, you are not dilating at the level that we think that you're supposed to be dilating. Like, this is not normal. So that is that path. The other thing is I can stay for another hour or two, but I'm going to need to assess you. And if you're not dilating, then again, we're back to this idea we may need to consult somebody. And I'm thinking to myself, my home birth is about to be taken away from me again. The first time it was taken away, they said that my baby wasn't growing properly. Now they're telling me that my baby is not coming at the time that's like my body is not doing what it needs to. My baby is going to go into distress. But because I was so determined to have my home birth, I decided to take a breath. I decided to get past my fear. And I asked, how is my baby doing now? And so the midwife is like, well, right now her heart rate's fine. She's okay. And I'm like, well, my waters are still intact. I'm not in any real danger here. What we're really looking at is if things continue to go down this path, something might possibly maybe happen. Go check out some of my other videos where I talk about assessing risk because this ties in. But the fact is like nothing was really wrong. The only thing that was wrong was that my body wasn't dilating on the timeline. And the thing is that labor is not linear. So by inviting the cervix checks, what this did is that it put me on that clock that I didn't want to be on a timeline that didn't fit for me. And in the end, I sent the midwife home and I slept for 16 hours. I did not have any labor contractions. I had some cramping, but it wasn't the high levels and the peaks of the contractions to let me know I'm back in labor. When I finally recognized I was back in labor, it was 5 hours, start to finish, where I was riding these waves and it was not horrifically painful. And I wasn't having any cervix checks because there was no midwife there. I brought the doula over. She was just keeping the pool warm. She read over my records for me to tell me what was going on with my cervix. And when she said, well, you closed right back up from 6 centimeters, I'm like, oh, my cervix didn't like that. And then labor shuts down. So here's a little secret that I also put inside your Empowered Birth workshop. Again, if you do want the self-study path, it is available for you. I will tell you more about that the deeper we go into this when I talk about the Empowered Birth method and how it helps you to get out of these natural birth traps. But I'm like, oh my goodness. Cervical dilation can reverse itself if you're stressed. Well, what's more stressful than trying to get through a cervix check? Like, seriously, that is so stressful and it's painful. There's a lot of moms that say it was so painful, or you bleed. You can bleed during a cervix check, even if they don't sweep your membranes. This is what happened to me with my first baby. I wanted to have my cervix checked. I was close to 40 weeks. They couldn't reach my cervix. And yet at the same time, when the midwife pulled her hands out, there was still blood on them. And then this led to me having to sit in the hospital in triage for 3 hours for them to basically be like, okay, there's no problems, the baby's fine. Like, I had a non-stress test done, and it's like, you're not in labor. You were just bleeding because the cervix was irritated. I'm like, oh, that's fun. And then I had cramping on and off for a few days, even though she didn't do a membrane sweep because she couldn't like actually reach my cervix. Now, I will be talking directly about membrane sweeps because that is the next natural birth trap. But for now, just recognize vaginal exams, cervix checks mean absolutely nothing and can actually reverse your dilation. So understanding that, then we're just going to basically look at how it undermines your confidence is, as I said, you think that your body is more open than it is, for example. And then what happens is they do the cervix check and they say, you are still completely closed up. How disempowering is that? How frustrating is that? You're getting close to 40 weeks, or maybe you've even passed 40 weeks. Maybe you're 41 weeks and your cervix is still hard and firm and it's still pointing to the back and no cervix changes are happening. Well, now you're thinking that you have to do all of the things on the outside, or you're thinking that you have to induce, because a lot of medical professionals will then say, well, we're going to start looking at induction if you don't go into labor. Or they'll say, oh, we're going to have to start this induction process right now. You hit 40 weeks and nothing's happening. So I guess we're just going to have to induce you. And then you fall into that natural birth trap. So undermining your confidence, pushing you into an intervention, and then also sabotaging your process, as I said, because your cervix doesn't want to be checked. You have just stressed out your body. And your cervix is like, nope, and shuts down and says, this ain't happening. This baby's not coming out right now. The other way it can sabotage your process is that cervix checks can introduce infection. Cervix checks can also lead to the weakening of your membranes. And if your membranes are weakened, then this can also lead to the amniotic sac rupturing too soon, which can lead to back labor because baby wasn't in the right position. Can also lead to you being put on the clock and then pushed into an induction. So the best thing to do is to keep cervix checks out of your birth plan completely, and also to not allow them during your prenatal visits. So keep your pants on during those prenatal visits. Now, I am also going to give a caveat here because there is a use for vaginal exams. If you are planning to have an induction for whatever reasons, these vaginal exams can help you to understand your Bishop score. If you have a score between 0 to 3, induction's probably not going to work. It's going to more likely lead to a C-section. And if that baby needs to come out for whatever reason, you may want to plan a gentle cesarean instead of an induction to avoid the trauma. Or you may want to do things early on to basically get your body ready for this induction. This is where the red raspberry leaf tea can come in, the evening primrose oil, or eating dates. But you know what? You don't have to do these things if you're planning a true natural birth, and you don't have to beat that clock for induction. If you're not planning to have an induction, these things will not get you into labor. The only thing that will get you into labor is your baby's lungs maturing enough to create that surfactant that then signals to your uterus it's time to add those oxytocin receptors that we were blocking before, so that you have these contractions and the cervix can soften. Until those things happen, your cervix is doing its job by staying closed. Your cervix is making sure that 7 to 8 pounds of baby, or even 5 to 6 pounds of baby, is not going to open your cervix prematurely. You want that. If your cervix is thinning out, that means that things are starting to move. It does not mean, however, and this is the other thing, that you're going to go into labor right away. You could be dilated to 4 centimeters and still have your baby next week. You could also be not dilated at all and have your baby tonight. Assuming, of course, you're at the end of your pregnancy, obviously, and that you're pregnant in the first place. But recognizing that your cervix is not a crystal ball, okay? It's just not. And we need to get out of this idea that the cervix check is absolutely needed to know where you're at in labor. It's not. The other thing that this can be helpful for is if you're starting to get discouraged during your labor process and you're wondering where your baby's at. Maybe somebody has suggested that we need to get things going. If your cervix is not in the point where you're dilating and something's wrong, and you sense that something's wrong, this can also inform your process to be able to make a decision around interventions. But if, however, nothing's wrong, again, aim for a true natural birth, the physiological process your body is going to do anyway, or pull back if you feel intuitively that something needs to change. But in order to be in your intuition, you need to get past your fear. You need to come to birth from a place of power instead of a place of fear. Because if you're giving into a vaginal exam, cervix check, if you have a category 5 care provider, what happens is they may sabotage your natural birth. I have seen this too often in the mom groups not to address this. And I'm not fear-mongering right now. I'm not trying to scare you. What I'm doing is I'm letting you know that this is a thing. You need to be aware of this thing. And the empowered birth method will help you to be able to make a plan around that too. Now, with a category 5 care provider, they want to do the cervix check. And while they're up there, they may strip your membranes or even break your waters. Now, if they are trying to get things going, they'll strip your membranes. And then they'll also tell you that if you can't handle that, you can't handle a natural birth. And they try to equate those two things, and it's not true. If they strip your membranes, of course, though, you're going to have a lot of cramps. It may put you into labor, but it could also screw up your labor that you weren't planning to have it be that painful, and now they've made it worse. If they are also doing this during labor, they could accidentally break your waters. Now, the other thing is that even if they're not intending to, they could accidentally break your waters. They could introduce infections. They could do things that cause your cervix to close up again, and now your failure to progress. So recognizing the problems with agreeing to these vaginal exams allows you to now make a decision about that. And that is where the empowered birth method comes in, because you need to be making these decisions from a place of power instead of a place of fear. So what you need to do, first of all, aim for a true natural birth. Pull back as much as you need. So this is where creating the birth vision is helpful. And this is part of the 5 pillars of empowered birth. Go and read my book, Your Empowered Birth, to understand the 5 pillars deeper. And there's also a little bit more about this inside of the Reset Your Mindset for Empowered Birth mini challenge, which helps you get past your fear. This is the first step. You need the right mindset. The next thing you need is the right education, which I've technically given to you, right? I've told you about how cervix checks actually don't serve you when you're having a true natural birth. And I also told you when they can be helpful. So you understand the difference now between true natural birth versus calling in that medical support. The next thing you need is the right environment. If you do not feel safe, your cervix is likely to close up. This is because biologically, if you're thinking about this from an evolutionary perspective, then we were hunter-gatherers. We were out in the wild. There were animals that would try to eat us or our babies. It is not going to be beneficial for you to go into labor and birth your baby in the middle of the jungle or in the middle of the forest or whatever, and then have a tiger or other predatory animal in the area at the same time. When a mammal senses that a predator is in the area, they will stop their physiological birth process so that they can get to safety. This means that if you are in labor or you are approaching labor and suddenly there's a lot of adrenaline and cortisol in your system, your cervix is going to be like, got it. Close back up. Stay closed. We're not ready yet. This is an evolutionary masterpiece out in the wild where animals could eat our babies. This is not helpful in our modern society where the medical system is going to do things to you if you do not go into labor and do not dilate 1 centimeter per hour, which is a whole other mess that I could get into. But if you really want to understand it, you can go check out my other videos on due dates. And you can also learn more about this by reading Rachel Reed's book, Reclaiming Childbirth as a Rite of Passage. Because no, the cervix doesn't have to dilate 1 centimeter per hour for you to progress. In fact, you could go from 3 centimeters and then suddenly quickly open up to 10 and baby's ready to come. So understanding that your cervix is doing its job by staying closed, you need to feel safe in your environment. Ties into the right facilitators. You need a care provider who is willing to sit on their hands and stop pushing cervix checks on you in order to stay out of those natural birth traps. If they are not going to do that, if they are really uncomfortable and they just want to keep checking your cervix, they're not the right care provider for you. You need to understand that. Your job is to either tune in to what they're saying or tune out and find somebody else. This is also why I suggest that if you are going to go into the hospital, you go in at the last possible minute. And if you are having a home birth, you only call in the midwife when you feel you actually need them. And if that is when you are pushing your baby out, then that is okay. That is okay. You don't have to have cervix checks. And that leads again into the final piece of the right support. You know, your family and friends, they mean well. But I remember at the end of my pregnancy with my second, and I knew that I didn't want a cervix check. Do you know what my mother was texting my former partner while I was in labor? She's like, shouldn't she go and get assessed? She needs to know how dilated she is. And it was just so insane to me that even though I was a birth advocate and had said over and over, you don't need a cervix check, that this was still the default that my friends and family were asking. How dilated are you? I mean, it's ingrained into our culture. So what you need to know is that you have to have that right support. You need to be in mom groups or have family and friends around you who know the cervix is not a crystal ball. You need people who are going to advocate for you. Your partner cannot be telling you that you should get a cervix check. They need to be supportive. Okay? They need to be supportive. And it's one thing to have somebody say you're doing good and everything, but if you actually don't want this check and you just feel like you're being pushed into it, having somebody just basically trying to get you to get through it when you don't want it and don't need it, it's not helpful. So your partner needs to basically also be aware that if you're starting to crumble under the pressure, they need to be able to take you aside and they have to say, hey, I know you don't actually want this. I know you're scared. Let's just reassess here. And if you aren't comfortable saying no, I can hold that space and make sure that they don't push this on you. I'll protect you because you want your partner to be your rock. And this is part of the empowered birth method. Again, the 5 pillars: right mindset, right education, right environment, right facilitators, and the right support. And again, if you want to know more about how to apply this, then I'm going to encourage you to go through the 3 paths to empowered birth, whichever way you want to go. Some go this way, some go that way, but all ways are the queen's way, and you are the empowered birth queen. Whether you recognize yourself as one or not yet, the fact that you've gotten this far into the video already tells me you are committed to having an empowered natural birth. And you know what? I am committed to you having an empowered birth, whether you work with me or not, whether you get any of my courses, or if you go into my premium coaching, because those are the 3 paths to the empowered birth method. Number 1 is the do-it-yourself path, which you are doing right now by watching these deep dive masterclasses. And all you need to do is keep watching the videos, like, share, subscribe to the channel, follow the little rabbit holes, the trails, the white rabbit that I drop, and tell you where to go next. Make sure you're also getting additional resources, and you can piece this together yourself. If you have any questions, you have an option of either staying outside of the inner circle and just following in the community at large, but not subscribing to the newsletter. If you have a question, you email the team, hello@empoweringmomsbirth.com. That is the fastest way to get a response. You can also comment in the social media, and I encourage you to do that as part of the do-it-yourself path, because this allows the algorithm to show this to new moms. It also encourages more moms to comment and ask their questions, because sometimes you just need to go first. And then that creates the ripple. A drop in the ocean creates ripples. Many ripples create waves, and enough waves can change the tide. So you ask your questions, you get the answers. If you email us, we'll get back to you within 3 to 5 business days. We'll give you an answer to your question, or we'll give you another resource that you can use that will help you on your empowered birth journey. The next path, if you like something more structured, is the self-study path. Now, I suggest that you start out with the Reset Your Mindset for Empowered Birth mini challenge. This gets your feet wet into how to go through these courses, because it is like labor. We start off slow, and then we start to slowly get deeper and deeper into the content. It gets a little bit tough near the end, and then we ease off and you have your transformation. But sometimes you just need to get that little bit of structure, and you need to know about all of those pieces. And again, with the Reset Your Mindset for Empowered Birth mini challenge, you just go into the playlist of the YouTube channel and you can just get those videos. You have options within this too. You can go to my Instagram where I have the Reset Your Mindset for Empowered Birth mini challenge. It might be buried by the time you actually see this video. I don't know how far into the future you've gotten to this video, but right now, as of recording this in 2025, those challenges are actually out now. They're just brand new, but things get buried. And you can catch those highlight reels, or you can get the actual training and go through it. And again, with the rule of 3, you'll want to watch it 3 times to really get those ahas. Also, the training itself is a deep dive. So I gave you everything. Information is free. I only charge for access to me. And then in addition to that, there is the transcripts for the challenge itself. So then you can go and follow your paths and get the additional links that I talk about, the resources that you need as you go through that. So that gives you the little bit of an overview of what self-study entails. And if you're not at that level yet, if you're like, that is a lot more than I can handle, then the do-it-yourself path is another way you get your feet wet by doing these deep dive master classes. You know, we all are at different levels, and I want to make sure that Empowered Birth is here for you no matter what. Now, again, with self-study, if you are someone who likes to have a little bit of extra help walking you through, maybe you do want to tackle the course, but you also want to be able to ask your questions. This is where self-study VIP comes in. And this is the first point where you would start to pay, because it's access to me and my team. Now, with these self-study courses, you basically have direct email support as you're going through the course, and you just ask your questions and we send you resources. If at any point you want to call in your one laser coaching call, then we reassess and see where you are at in the process of your work. If you're not far enough into it, I'm not going to give you that call. Instead, I might record a video personalized for you, and I'll be like, here's the answer to your question. Or I might redirect you to some other resources that help answer that question, because I want you to go through the entire process to get the transformation. We're not going to stay stuck in that one question. So once you've gone through the entire course and you've done the work, if you want to utilize that call, then we get on and you get that support. I get to look through what you've done with your homework, just like I've done with my clients when they send me their birth plans. And I can be like, okay, I see this, there's a little bit of concern here. What do you mean by that? Okay, got it. Here's your concerns. Here's your perspective. Here's all of the unique things that lead to you possibly getting your natural birth or not. And here's how we're going to pivot to get you back on track. And that allows you to still get your empowered birth, even though with premium coaching, the third path, I don't work with just anyone that comes to me. Usually it needs to be both beneficial for me, not just monetary, but in the case story that I'm going to create for my clients. And for the Empowered Mom movement, I look for moms who are pioneers, moms who want to have VBACs where they're being told that they can't, moms that want to have natural births and they might have things that are working against them, either in their own medical condition or just outside in society telling them what they are capable of. In fact, my main clients that I had at the beginning of the empowered birth journey, they were moms that were basically told they were too old, too fat, had too many C-sections, or they otherwise weren't allowed. And I proved it wrong with the empowered birth method. There have been moms that wanted to have a VBAC after 3 cesareans, and they were told that if they went into the hospital, they would automatically get a C-section. And I managed to help them turn that around so that the medical system no longer was putting that pressure on them. I've had moms who have had home births. I've had moms who have had unassisted vaginal births in the hospital. Like, there is no limit to what you can do with empowered birth. If you can dream it, you can achieve it. And you may be a pioneer, but let me just guide you. Let me help you in getting your empowered birth. And even if you can't work with me at the highest level of premium coaching, because again, I don't take on everyone, this is a steep price tag, this is a time commitment, and it has to be aligned. You need to be at that level where you can afford it. I'm not going to do it if you can't afford it. Then the next step is I've got group programs where there's a little bit more of an incubator of support. They are still intimate. And it is still a basic assessment to see if you'd even be right for that. So because I keep these very exclusive, and because there is a time commitment, and because it is a steep price tag to get in, I have created the extra paths of self-study and do it yourself. So that's again where you would want to start is if you really want to get a taste of the coaching, you do self-study VIP and you get a laser coaching session. You get to see if it's right for you, if you want to go deeper, or you can just keep doing it yourself and you get that transformation anyway, because I am committed to you having an empowered birth, whether you work with me or not, whether you get any of my programs. I want you to have it because when you have an empowered birth, you're an empowered mom for life, and no one can take your power away from you ever again. So now let's recap because there is a lot that we have gone through, okay? So the big takeaways that you want to know is that you do not want to have cervix checks unless you're planning to go the medical route. If you're planning to call in interventions, it can be helpful to know where your baby's at in station, where you're at in dilation, where your cervix is positioned, and effacement. It can help you with that. But if you are planning a natural birth, you do not need to have the cervix checks. They do more harm than good in that lens. So if you're planning an induction, it's good because you can kind of see where your bishop score is at. If you are not planning an induction or you are not having any issues with your birth and you are not planning to call in any medical intervention, the cervix check can work against you. It can lead to you being told that you are not showing signs of labor progress. You are not showing any signs of labor and you are failing to progress. It can also cause you to have an infection. It can cause your membranes to weaken or even rupture. And this can then lead to a cascade of interventions that you don't want. It also puts you on the clock. So even if you're having a home birth, if you have a cervix check and your midwife has obligation to the hospital to let them know about your progress and they are charting it, then what happens is now they have that baseline that they have to keep going and you're opening the door to more cervix checks than you intended to have in the first place. I'm also going to say you can check your own cervix if you really want. And if you can't reach your cervix, then that means it's pointed way to the back. The other thing is, again, your cervix is not a crystal ball. In fact, by the time I went into labor again, I didn't check my cervix. The only time I really checked was when my water's released and my partner's like, should I call the midwife? And I'm like, I need to see where I'm at. So I put my fingers inside and her head was right there. Like she was already on her way out. I couldn't reach my cervix because there was no cervix at that point. Baby's head was in the birth canal. So recognizing that you don't need a cervix check, they are going to undermine your confidence. And unless you're calling in medical intervention, just say no. Just say no. It's as simple as that. As the shirt says, right? Okay. So thank you so much for watching. I really appreciate you getting this far. And as I said, you want the rule of 3. Go back and watch this again for a second time, and you're going to get those aha moments. You watch a third time, you can take more notes, and then you're going to have it integrated. And if you go and get the transcript, you can also go deeper with this and get the links. And if you want to go deeper with the Empowered Birth Method, your paths are to go for the Reset Your Mindset for Empowered Birth Mini Challenge if you haven't already gone through that. Read Your Empowered Birth, which again gives you the overview of the Empowered Birth Method and the 5 pillars and how to apply those and optimize them. You just go to the Empowered Birth Book playlist on YouTube, or if you would like to support the Empowered Birth movement, then you can purchase a copy on Amazon because proceeds do go back into creating things for the Empowered Mom movement. I am committed to moms having more choices in their births. And you know, we really do need to shift the birth culture away from this culture of fear. So the more options that we have for birth, the more moms are going to be able to get away from the fear-based medical culture. And then the birth workers who actually want to support true natural birth will be able to practice the way that they know needs to actually happen instead of this system of control. So recognizing that, again, if you found value in this video, please like, share, and subscribe to this channel, pay it forward, pass it on to other moms, and keep following because next week I'm going into membrane sweeps, trap number 4. So stay tuned for that. So thank you so much for watching. Have a happy, empowered birth journey, whether that is birthing a baby, birthing a business or other creative project, or birthing a new version of yourself. Empowering Moms is here for you. And I will see you next week. Namaste.